Welcome to the Gum Guru podcast with Dr. Macon Singletary. I'm Jason Kong. Thank you so much for being here with us. Dr. Singletary, how are you doing today?
Better than I deserve.
That's what we like to hear. We've got a great show on docket, and we are going to be talking about daily habits that keep us out of the dental chair. And, we always love going to see you, Dr. Singletary, but, there is also that aspect of, if we don't have to see you for more than we need to, that's also good. So let's talk about this. We've come to this pretty often on the Gum Guru, talking about the importance of preventative care. But what are some daily habits that we can be focusing on to help improve and maintain our dental health?
Well, Jason, I believe in the KISS principle. Keep it simple. I was being interviewed last weekend, and the individual was from Smithfield, and a physician down there, and he was talking about, I see decay, and I see, rotten teeth, and they can't afford, dental care. And I said, well, how many times a day do you brush your teeth? And and he said twice. And I said, well, what do you think about these people? And so I don't know if they brush their teeth at all. Well, it's real simple. Plaque is the culprit intraorally. And if you even it's the physical manipulation of the bacteria. It's the bristle of the brush, the thread of the floss. And so if somebody goes to the grocery store or pharmacy and buys a toothbrush that's extra soft and brushes 4 times a day, and I don't care what toothpaste they use. To me, toothpaste is like car compound. There is purposeful use of toothpaste, and we make recommendations for people who have high decay rate, but it's the physical manipulation of the plaque, the bristle of the brush, the thread of the floss. So if somebody brushes 4 times a day effectively, and at least once a time, think the tooth is a mirrored box. You're polishing all 5 surfaces, cheek side, top, tongue side. The brush the only way you get in between the teeth is floss. Now, if you have good use of your hands and manual dexterity, flossing using your hands is the way to do it. Now, I have patients with rheumatoid arthritis or Parkinson's, and they get worn down. So there are dental tools or aids that we can provide or help them with. But keeping it simple, the most important is removal of that bacteria.
Yeah, that's great. That's great advice. What else can we factor into our daily routines?
Diet, what you eat. Over time, every tooth developing has developmental discrepancies or crazes that are natural. And over time, these crazes can become cracks. And what causes that? Well, clenching and grinding, but eating things that are real brittle. I've been doing this a while, and what I've been compiling in my mind is, what products are being used on patients that over time don't work, and I have them in my mind, but what items that people eat that can affect their dentition. Almonds. They are brittle, and you chomp down an almond, you can crack a tooth in half a heartbeat, and you don't realize it. Generally, it'll happen in individuals over the age of 40 because they've been around a while. Younger individuals, the teeth are stronger, haven't been chewing a lot. They haven't been around enough to, experience the day in, day out rigors of just mastication. But diet, don't open your nabs with your front teeth. For people from the South, we know what nabs are, but it's the cellophane around Nabisco cheese crackers. Cut your apples up, slice your corn off the cob, and just be aware. Don't crunch ice. The things that you eat, and watch high added sugar foods. High sugar contents. The added sugars are not good. Sticky sweets. Those things that you can't, even with your tongue, get off, and it sticks there for a while. What happens when you eat, the bacteria grows exponentially for 30 minutes. And if you things like sugar, they just go crazy. And so it produces an acid for that first 30 minutes. So that acid will demineralize the enamel, and then under the enamel is dentin, and then the bacteria can get into the dentin and then into the nerve. So your diet is significant. And just avoid those things that are brittle, avoid sweets, and try to eat things that like leafy greens and vegetables. And with this day and age, you got to be careful of your food source because of additives and preservatives. And if you have your farm, eat your vegetables off your farm.
Yeah, that makes plenty of sense. And, I think we're aware of the big dietary culprits, but you mentioned some that really surprised me, almonds in particular, things like that, where, it's, but it makes sense though. It makes sense that that can happen as you get older and how you may completely miss it altogether. Mm-hmm. What else? What else should we be aware of?
Well, again, things that people talk, we've talked about whitening. What are things that you drink that may stain your teeth? Coffee is one of them. Rinse after that. I drink coffee all the time, and I have a whitening material that I use that is a low concentration. That if I'm going to a meeting, so I don't look like my teeth have been painted tan, my wife said, "I think you need to whiten your teeth before you go because it might age you a little bit." But we do have, like I say, a natural color to our teeth that we don't want to manipulate too much, because it becomes obvious that you're doing it. But wine, that can stain teeth, tea. But I always tell patients drink half your weight in water, ounces a day, and I think that's the best thing you can do because your sodas, they have preservatives in it and sodium pyrophosphate, and you can take a tooth and put it in a bottle of Coke, and it will dissolve the enamel on the tooth. And so chronic soda drinking can affect the teeth, and so you want to avoid that.
Yeah, for sure. It's it just makes perfect sense that we would want to limit those things that can produce those stains or create any sort of decay in that regard. What are some other habits that we can introduce to our daily routine?
Yeah, just again, brush 4 times a day, floss. Make sure that you supplement because even though your teeth are already formed, there's a constant challenge around your teeth. Daily growth of bacteria, the physical removal of it, you're going to have an inflammatory response. You want your body be able to handle it in a normal fashion and repair. And so we go to get a naturally sourced vitamin, one-a-day vitamin that has all the vitamins and minerals in it that allow us to rebuild and repair tissue around our teeth, the bone and gum tissue. So being able to have the right diet, supplement, because we really don't get the natural minerals and vitamins in our food, particularly if you go to the grocery store. Now, if you got your farm and your vegetables are coming off your farm and how you're growing your fruit and vegetables, you're getting the potent vitamin source that you need. But our food source is depleted with that, and you got to supplement and do it with natural. You don't want a synthetic vitamin. The only thing that does is pass through.
Dr. Singletary, as we're browsing our phones and, watching different advertisements, oftentimes we're promoted with different sorts of supplements or tools that maybe we could try and implement into our daily routines that may have an added benefit and maybe they don't. But can you talk a little bit about, some of the current trends that you're seeing and whether or not you think they're a good idea to include in your daily routine? Well,
again, as I mentioned initially said, I believe in the KISS principle, keep it simple. But, there are, when I tell patients to brush 4 times a day, and to me it doesn't matter what toothpaste they use, toothpaste does have added value. And particularly, toothpaste or chewing gum with xylitol in it. If you're in the middle of the day, I have individuals say, well, I'm in my truck, I can't brush. Well, put the toothbrush in the glove compartment of your truck. But xylitol, chewing gum with xylitol in it may help, in the middle of the day. That xylitol will affect bacterial growth. Again, there are, toothpaste. Again, the fluoride toothpaste will leach into the tooth surface, but you have the hydroxylapatite toothpaste. Some people talk to me about oil pulling. That's labor intensive because you got to do it for 15 to 20 minutes. But it has a monolaurin in it, which is sort of like an anti-inflammatory, and it'll help mineralize the tooth a little bit as well. But it also affects bacterial growth. But you got to do it for 10 to 20 minutes. But there is something to it. So going from keeping it simple to what can you do during the day? That xylitol is a good one, the chewing gum, or even just rinsing after you eat, because there is some people say that you shouldn't really brush after you eat because there's an acid pH that can demineralize the tooth structure and you're wearing the enamel down. I don't disagree with that. Just rinse, and that'll get the pH back up, and then brush. And if you can't brush, pop in some xylitol and you just do that. I mean, chewing gum that has xylitol in it. You be careful, though, because there's some chewing gum with sugarlose in it. You don't want to do that one.
Good advice. Good advice. What's our action step for today's episode?
So what you want to do is take your toothbrush with you. No, but just be aware of those things that you do eat. And almonds are good for you, but they're very brittle. You can do sliced almonds. But the main thing is just whatever fits your lifestyle. Try to incorporate the fact that what you do at home is the most inexpensive way of treating gum disease or oral health or dental decay, and just be consistent.
I think that's perfectly said, and that brings a whole lot of insight and ways that we can really do our best to avoid unnecessary dental work that, again, puts a strain on the pocketbook. So anything that we can do to incorporate into our daily routines and create habits for ourselves that create and promote the best and healthiest outcomes, that's the way to go right there. Well, that's going to do it for us today. On behalf of Dr. Macon Singletary, I'm Jason Kong, thanking you for listening to The Gum Guru.
If you would like to know more about ways to make sure your smile is healthy, or more information on any of the treatments in today's discussion, check out their website at northraleigh.perio.com. If you have other questions you'd like to have answered on the Gum Guru podcast, send them to contact@northraleigh.perio.com.